You still don't get it, do you, boys? There ain't no countries anymore. No more good guys. They're running the whole show. They own everything, the whole goddamn planet. They can do whatever they want. What's wrong with having it good for a change? Now, they're going to let us have it good if we just help them. They're going to leave us alone. Let us make some money. You can have a little taste of that good life, too. Now, I know you want it. Hell, everybody does.
You do it to your own kind.
What's the threat? We all sell out every day. Might as well be on the winning
like
team.
Button and subscribe. I need you to hit the like button so it can register on YouTube algorithm. That's why I don't monetize it. All I need you to do, and again, if you enjoy this free content, this free information, and you leave here smarter, which is my intentions, then go ahead and hit the like button and share.
First, we were told that wearing masks would do more harm than good, which is what the science still supports.
Right now in the United States, people should not be walking around with masks.
You're sure of it, because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is.
Fauci, mask off, mask on. Which one is it? Again, Satanists, these Luciferians, they like to create confusion. This shit is all about control, this mask. Do your research.
Today, I'm joined by the County Executive, Warren Evans, by the Head of Detroit at Work, Nicole Sherrod-Freeman, and as always, Denise Fair. We give you an update on what's happened in the last 24 hours and start where we normally do with the Detroit Police Department. I think as we've been talking about, we have dramatically accelerated the testing of all of our officers. As of today, we have 91 employees of the Detroit Police Department that have tested positive for COVID-19 and 17 employees of the Detroit Fire Department. Today we have 525 officers who are quarantined, but I'm pleased to report 120 officers have returned to work and are back on the job. We are speeding up the testing process. We are speeding up everything about this to get our healthy officers back. We have 136 members of the Detroit Fire Department currently quarantined and isolated. Last night again, the 911 response time was excellent. It was about 10 minutes. We are benefiting enormously from a major reduction in crime and 911 calls. That's, I'm certain, resulting from the shelter-in-place order, same kind of thing that the city of New York has seen. But the fact that Detroiters are pulling together in this way is making it possible for us to continue to run smoothly at the Detroit Police and Fire Departments until we can get the rest of our officers back. The process is pretty interesting now, as I've talked about before. We put a thermometer on everyone at the Detroit Police and Fire Department as they come into work, and I got 2 alerts this morning, the first 2. We had one officer who came in over 100 degrees and one firefighter who came in over 100 degrees and were immediately sent home. This is the kind of rigor that maybe had Michigan been a little later in the process, we would have known to put in place. But I'm talking to the U.S. Conference of Mayors on Friday, and they all want to talk about if you had known earlier what to do, what would you have done? And yesterday I noticed I was doing an MSNBC interview, and there was a police officer in Miami standing right next to the reporter with the microphone. I said, you would never see that in Michigan again. Parts of this country still don't get what separation means. There's something about us that until you see the virus having an effect, we don't act. But I'm going to be talking to my fellow mayors on Friday about the actions you need to take before the virus hits your community. And certainly we would have put much more distance between our police officers earlier. Denise Fair is going to give you the numbers, but our positive tests for Detroit has jumped about 400. This is a function of our very successful testing program, and you're going to see the number of Detroiters who test positive climb by significant numbers every single day. And I am going to ask maybe for some self-reflection on the part of the media in the way this story is being reported. It's been kind of disturbing to me to see stories written about why is Detroit a hotspot, with all kinds of theories about poverty and people not taking care of their health. And I tell you what I find so disturbing. One of the wealthiest communities in New York, New Rochelle, had the first major outbreak on the East Coast. Middlesex County in Massachusetts, a very well-off county, has a significant outbreak of coronavirus. And here in Michigan, it has been the city of Detroit and Oakland County that has had the highest concentration. But nobody goes and writes stories about why is New Rochelle a hotspot? Why is Middlesex County a hotspot? Why is Oakland County a hotspot? Why is Oakland County got higher death rates than suburban Macomb and Western Wayne? And so it seems to give people leave to throw out whatever theories they want about why a poor city like Detroit is a hotspot. And I spoke to Dr. Mark Zervis this morning, who was also deeply disturbed by this coverage. And he said, there is no evidence that the coronavirus checks your bank account before it jumps to you. There's no evidence that this spreads more quickly among the poor than the wealthy. In fact, the overall history of the country is the opposite. And so we have a very serious problem in the city. We lost a number of other members of our community even yesterday. But Detroit is hit early for the same reason Oakland County is hit early, for the same reason Kings County, Washington was hit early, for the same reason New Rochelle, New York was hit early. Somebody brought the virus into this community early on. It spread in this community before we knew what was happening. And the places in this country that are getting hit are the places that were infected first. And now we are working together with, I think, great leadership from the governor to fight it off. But I would just ask you in the media to just reflect on what you're writing. And when I see a headline, when you have essentially the same number of fatalities in Detroit and Oakland County, and yet I see a headline yesterday, Detroit has 1/3 of all the deaths in Michigan. And you say, wait a minute. What prompted you, when you had two entities at the same level, to pick one and put it in the headline? I'm just asking that maybe you reflect in the way that you are covering this. We have more progress that is being made to help our businesses. Yesterday, we sat here and Kevin Johnson rolled out a $3.1 million fund for small businesses. Today, I'm partnering with County Executive Warren Evans, and thanks to the support of the state of Michigan, MEDC, the Michigan Strategic Fund, there's another $1.6 million that are available. And so since we announced this yesterday, we've had 300 companies that have already applied for the $2,500 to $10,000 support to keep going. And now with the county executive support, we're adding another $1.6 million, and we're going to run a single program. You only apply once, and the county executive and I have put our staffs together in a single team to make it easy for you. And with that, I'll turn it over to Warren Evans to talk about the details of how this is going to work.
Well, thank you, Mr. Mayor. I appreciate it, and I also co-sign your sentiments about reporting. We're clearly in a crisis here, and the county and the city have seen fit to partner in an application with the state for small business grant funding. The funding will be generally capped between $2,000 and $10,000. But one of the things that's really important about it is the speed with which these efforts are going on. The county also last week put together a program, a $10 million program for small businesses in Wayne County. And while this virus has been speedy and spreading, and the significance of our testing quickly and social distancing the way it needs to be, we also need to provide speedy relief to our small businesses. And I also echo the mayor's sentiments in how quickly and positively people have been responding to apply for the funds. They are grant funds in this program with Wayne County's economic development and the DEGC to the tune of about $1.6 million. We want to get that in the hands of the qualified businesses as quickly as we can so that they're able to keep sustaining themselves. It's April the 1st. Everybody knows what happens the first of the month. Your bills come due. And when the revenue's not coming due, that's an issue. So we think it's a great program. And Mayor, thank you very much for partnering with us to do it. And if there are other questions later, we'd be happy to answer.
Thank you, Mr. County Executive. For those who are sitting at home and want to make money, whether you've been laid off or would like to go back to work, everything is not being cut right now. There are 1,100 jobs available for Detroiters where people are hiring right now. They are in the essential industries, and they are jobs like working at the grocery stores, at Meijer's, at CVS, at Mike's Fresh Market. They're hiring both for the retail clerks and for people stocking the shelves. We've got a number of companies hiring drivers, companies like Black & Mobile that serve 10 different restaurants taking food to residents' homes, and U.S. Ice transporting dry ice for storage. Henry Ford Health System is hiring folks from the people who push the wheelchairs to the people who clean the rooms. There are 1,100 jobs that if you go to Detroit at Work, you could be working really in a matter of a couple of days. This isn't, 4 weeks ago, Nicole Sherrod-Freeman was hiring for the Chrysler plant on the east side. The world has changed, and now we're hiring for the jobs that are open today, but there are opportunities, and with that, I'll turn it over to Nicole Sherrod-Freeman to talk about what's out there and how you go about applying for it.
Thank you, Mayor, and thanks for your leadership on this. So as the Mayor said, there are more than 1,100 jobs open right now, and we want to direct you to DetroitAtWork.com, just like we did for FCA. You go to DetroitAtWork.com, you scroll down to the Ready to Hire initiative as a special call-out button. You click on that. You give us a little bit of information about yourself so that we can also connect you with other resources, and then you can apply for the jobs that the Mayor has mentioned, along with many others. Now, some of these jobs require customer contact, but many of them do not. So some of the delivery driver roles don't require any contact. You're loading into the back of the truck or off the back of the truck doesn't require you to come in contact with any people. There are loaders. There's a distribution company over on East 8 Mile that's looking for loaders at about $14 an hour. So many of these jobs pay in the $10 to $12 an hour range, but there's also a wide range of jobs that pay $14 an hour or more. And these companies are either expanding their businesses as a result of the virus, or they are backfilling workers who need some time off. So I just ask you to go to DetroitAtWork.com, or if you don't have access to the internet, I'm going to ask you to call 313-962-WORK. Again, that's 313-962-WORK, work, and we can help you by linking you with an opportunity that fits your interests and your skills. Thanks, Mayor.
Thanks, Nicole. And we close always with the hardest part of these sessions to update you on the impact on our neighbors. I just came from visiting the new field hospital that the Army Corps of Engineers is so skillfully setting up at the TCF Center. It's going to have in the range of 750 beds if we need them, and the governor and I went over and visited. It's very impressive. I very much hope we don't need it. If we can listen to what Director Fair is saying about social distancing, there's still a chance that we can avoid it. But we're preparing as if the surge is still coming, and if we hit the point where we can't take care of all of our sick neighbors in the hospitals. And so the plan is to have several hundred beds at the TCF Center for coronavirus patients. The idea would be that as you come off the ventilator and you're recovering, that you're moved from the hospitals and recover over at the field hospital at the TCF Center to make room for other patients to be on the ventilators and other patients to occupy the hospital beds. You can't look at that hospital and not be hit by the magnitude of what our community is going through. And with that, for the update on the latest numbers, Director Fair.
Thank you, Mayor Duggan, and again, thank you for your leadership. So as of today, there are 2,483 confirmed cases and 82 confirmed deaths. Now, as compared to yesterday, this is 400 more positive cases and 9 more deaths, again, just from yesterday. Now, we're going to see the number of cases continue to increase because of the work that we're doing now at the drive-through testing at the state fairgrounds. And again, this is what we should be doing. We are testing. So again, you're going to see the numbers continue to rise. Now, we know this virus has no geographic boundaries, and COVID-19 has been and will continue to be an equal opportunity virus. Now, we don't have all the answers. However, as more residents continue to get tested, we'll have a greater understanding of the how and the why. And we are looking at our data. We've noticed that cases are all across the city of Detroit. Now, the role of the Detroit Health Department is to provide communication, education, surveillance, and emergency preparedness towards ensuring the health and safety of our community. Now, because COVID-19 has no boundaries, we need to do our part. We need to heed the governor's executive order, which is staying at home. And I know I sound like a broken record, but I want to make sure people are listening. Stay home. If we stay home, we will help to slow the spread of COVID-19. And it's time that we hold ourselves accountable and those that we love, because what we choose to do or what we don't choose to do will impact others. Please visit the Detroit Health Department. We have the latest information on our website at detroitmi.gov/coronavirus. You can also call us if you have questions or concerns 24 hours a day, 7 days a week at 313-876-4000. And again, I will say, please stay home so that we can slow the spread of COVID-19. With that, I'll turn it over to the mayor.
So a few other items before we take questions.
Dr. Fauci, mask off, mask on. Which one is it? Again, Satanists, these Luciferians, they like to create confusion. This shit is all about control, this mask. Do your research. Most of you don't want to research because you're intellectually lazy, broken ass cowards. So you'll just follow anything that they tell you. Now, this propaganda for control is so transparent. You niggas are just So all of a sudden, mayor in a black city, Detroit, states, oh, he doesn't want the Johnson & Johnson vaccine. Other too good. And he calls the White House, well, not strike that. What's his name? Pedophile, dementia, Jim Crow, decrepit Joe calls this idiot and comes up with, oh, okay, yeah, the Johnson & Johnson vaccine is good. Then what is it? ECLU Center, old Joe Louis, or strike that, the old Coble Hall. All right, yeah, we're gonna do that. We're gonna do it there. Man, how slow are you individuals? How slow? It's propaganda all day in your face, and even using Johnson & Johnson. What do black people identify when somebody say Johnson & Johnson products? Baby products. products that we'd have had since we've been babies, that we used on our babies. And it's to lower your suspicion and rightfully so paranoia on the medical establishment. Will strike at the medical apartheid system for black people. So these are the levels that they do, and this is why they play us like little fucking kids. Watch, it's gonna be a bunch of niggas out going to that the old Coble Hall, the TCLU Center or whatever that they want people to go to. It's gonna be a bunch of you niggas. Go sit up out there getting this goddamn vaccine. You don't even know why. They done crept into your fucking conscious, right? Like they always do, to steer you sheeple where they want you to go. So this motherfucking white mayor, fucking slime ball Satanist, think he being fucking slick. Being slick because niggas so dumb and keep electing this dumb nigga too. Niggas just want to die. I believe most of you motherfuckers just want to die, just want to be put out your goddamn misery. Period. You can't see this shit for what it is. This Johnson & Johnson now vaccine.
Testing.
You gotta be fucking beyond
from Abbott Labs arrived
well, it is a 47% illicity rate here in Detroit.
Right now,
oh, I don't really care about you old niggas.
It's becoming clear that Detroit will be the first city in the country
care about
to
the baby.
use the 15-minute testing to test our police officers, firefighters, EMTs, and our bus drivers, so that we know right away the results. And that's going to be up and running in the next 24 hours. For those in the media that want images of it, I'm sure John Roach will figure out how to work that out before we start having patients come through. We had another 600 people tested at the fairgrounds today. We've booked 3,000 appointments at this point, and we're getting a lot more calls from folks who have now gotten a doctor because of the 22 new doctor's offices, and as of now it's 25. We've had 3 more added since yesterday. There are 25 doctor's offices in the city that will take new patients. Most of them don't care whether you're insured or not. You can sign up. We had a number of transportation companies come forward, and we're negotiating the agreements now. I'm very hopeful that by Friday, those individuals in our city who don't have a car, don't have transportation, that we will have a means to get you a ride to the drive-through testing center to make those tests available to every single Detroiter. And we're working out the details right now, but basically the cab services or the transportation services will just be brought right to the front of the line so they can go straight through, take the patient back home, and the transportation companies can continue to do their work. And so I think we'll have more on that in the next 24 to 48 hours, but we're going to keep going until we get everybody in the city to have equal access to testing. Senator Stabenow says that the FEMA 200,000 swabs are on the way, but so far nobody spotted the FEMA truck. But we are continuing to pull together swabs and test kits from different areas, and I'm hopeful before the end of next week we have enough materials to be up to 1,000 tests a day. The Fairgrounds program, I know a lot of folks have gone through it, and the reaction I'm getting is almost universally positive in their experience. With that, we'll take any questions.
Mayor, before the reporters come up to the microphone, we've got one question wanting to know, this could be either for you or Chief Fair, in terms of whether it's time to go beyond just social distancing and encouraging people to always wear a mask when they go outdoors.
So the question is, and I'll let the director talk about it, basically I put a mask on from my car to in a building and back if I think there's going to be random interactions, and the mask does as much to keep you from potentially spreading germs to somebody else. And so we're going to follow the state guidelines and the federal guidelines, but I see more and more people walking, riding bikes with masks. I think it's a good thing, and I'll give it to our health professional to ask her opinion. Director?
Sure. I think as a precautionary measure, if you feel as though the mask will protect you, then by all means. I think it's important that we do follow the CDC guidelines as well as the state.
Mr. Mayor, Ross Jones wants to know what measures are being taken to ensure that the city's EMS operators are able to meet the growing demand for service as COVID spreads, and are there any plans to add additional resources?
I'm sorry, I missed the middle of that question.
So as COVID spreads, are we doing anything to prepare for a surge in EMS runs?
Well, we've had a surge in EMS runs, and our EMS workers are doing a terrific job. So the answer is yes. We check the staffing every single day. We have been extremely fortunate that while we've had a lot of positive COVID-19 among police officers, we've had very little among EMTs. Our EMTs are so used to protecting themselves from communicable diseases 24 hours a day, 365 days a year. I think maybe they were better prepared. But I talk to Fire Commissioner Eric Jones every day, and so far, the EMTs are doing a great job.
Okay. And you'd like to know, do you foresee a time when we might need to bring in additional resources?
Yeah, I'm not in the business of predicting the future. We're prepared. We have preparation plans for all alternatives, but most of the folks who are heading in on COVID-19 aren't going in an ambulance. Some do, but
the perfect protection that people think that it is.
But now, even as the COVID-19 pandemic is turning out to be less harmful than the seasonal flu, we are being told to wear the mask. Austin, Texas has threatened a $2,000 fine for those not wearing the mask, and have even suggested that we wear the mask while at home.
We still need people to wear the mask in public. We still need people to keep social distance and isolation. Ryan, the one thing I want to try to get across today is we need to do that when we're in our homes also.
Science tells us that these masks are doing nothing but hurting our natural immune system. So why is it so important that we wear the mask? If one were to look at what is happening as if it were a massive initiation ritual, then things may begin to make more sense. The initiation ritual can be found throughout all of human history. We find it in ancient tribes and religions, all the way up to modern gangs, fraternities, and in the military. Psychological studies have taught us how initiation rituals work. Primarily, how they increase a person's desire to conform to the group they are being initiated into. The ritual is almost always the same. First, the initiate is isolated. Their familiar everyday routines are disrupted, and their normal rules of living are altered. The initiates are made to look the same. Their heads may be shaved, they may be given matching outfits, or they may be instructed to wear a mask. These techniques symbolically strip the initiate of their unique identity, so they can cease seeing themselves as an individual and begin seeing themselves as part of the group. The wearer of the mask loses his previous identity and assumes a new one. The initiate is then subjected to just enough trauma to put them in a mild state of cognitive dissonance. This dissonance puts the initiate into a state of confusion and anxiety. They are now ready to be transformed into a member of the initiating group. In their isolation, thoughts they have ignored or buried for years suddenly become unavoidable. Emotions are triggered, and a new window of thought is opened within the initiate's mind. And in this state, the new normal is introduced. This worldwide initiation ritual is creating a massive separation in humanity.
In the Illuminati card game, inspired by Robert Anton Wilson's Illuminatus trilogy, the Death Mask card has some interesting text, quoting, "Whoever wears it can see a slightly different world through its staring eye holes, and when the mask is removed, the different world is the true one." End quote. The world after coronavirus, we will inhabit a different world. After the coronavirus passes, your world will not go back to normal. According to BuzzFeed, the world will be different.
Support us by sharing, liking, and subscribing.
We need black media. We need strong black media.